All right, so we're gonna set up a PCA. So what you're gonna need is your CAD PCA pump. You'll need your Dilaudid medication cartridge that will be stocked in the Omnicell. You'll need your CAD PCA key that will also be stocked in the Omnicell. You will need a needleless connector or a clave, a flush, and your PCA tubing. So PCA tubing is stocked in the clean supply, kind of looks like syringe pump tubing. It has this filter at the end and then this Y site. So this light blue cap goes to your patient. So first off, it'll ask if you want to start a new patient. We'll say yes. And then it's going to ask to put in your patient profile. So this will be part of your orders in Epic. For the sake of education, we'll do adult opioid tolerant. So a patient who is used to receiving opioids or has had a PCA before. So we'll click select. The 3 settings you can do on a PCA are continuous only, so it just does a slow rate. There is no ability to give a push dose. PCA and continuous is a push dose with also a slow continuous rate. And then PCA only is push dose only. So for this one, we'll do PCA and continuous. For sickle cell patients that they're starting a PCA on in the ED, this is typically the setting that you'll choose. After that, it'll ask you to select your medication. For down in the ED, 0.2 milligrams per ml of Dilaudid is what will be stocked. So we'll click that one. And then it'll ask you for a secure code, which is provided by pharmacy. This changes every 6 months. It just changed in April, so it'll next change in October. This code is provided to you in the charge binder. So I will put that code in. Okay, and then we'll click accept value. And then you'll verify all your settings. We'll say yes. And then you'll review your pump like medication dosing. So we'll click review. And then this is where you put in all of your dosing. These will be in order in Epic. You can see these on if you go to the narrator on the left-hand side, if you click on the Dilaudid in the MAR tab, you can see your dosing there. Otherwise, if you actually go into the MAR and then click that little drop-down arrow, these orders will be in there. So for this video, we will just keep all of these settings, but if you needed to change, you would just click select and then use your arrows to go up or down. So we'll go back to point 2, save. And then next to every order or dose, you have to click accept value so that you get that little check mark next to everything. So click accept, accept, accept. And again, this is all based on the orders in Epic that the providers have put in. We're just going through this for education purposes. Reservoir volume, a full Dilaudid PCA cartridge will have 100 mLs in it. So we're starting a new PCA, so we'll click accept and then next. So now it's telling me that my cassette's not attached. So we'll take our key. You're gonna unlock the side here, unlock, and then pull your latch down. This cartridge so it'll come in a bag in the Omnicell. It'll be labeled and have a barcode on it. This has just been used before and it's for education, so we don't have a label. This little tubing will already be connected to it. And then up top here will be like a royal blue safety clip. All you have to do is just crack that off. So to put this in, these little hinges over here, we'll click into these. And then you'll push it up and then you can close your clamp. So now it recognized that our cassette is in. It's gonna ask you to prime your tubing. Your PCA pump will prime your tubing for you. So again, Y site goes closest to the patient. We'll take the longer, thinner end and we'll connect it to our cassette over here. Make sure that you're not connected to your patient. Make sure your clamps are unclamped. We'll click yes. Again, disconnect from patient, open clamps, and then you'll click prime. So if you can hear it, this is empty. So otherwise you would see the medication going through. You'll keep a close eye on it. Make sure it goes down through your filter. And then just when it gets to this bifurcation in the Y site is when you'll stop it. We want to stop it here because if you prime this with Dilaudid and then you have your maintenance fluids hooked up over here and you start maintenance fluids at like 100 mLs an hour, you're going to accidentally bolus your patient with Dilaudid. So since we're primed with Dilaudid up to here, you'll take your clave. Put your clave on this white piece here. And then your flush. And you'll prime your tubing with your flush so that this main part of tubing that's connected directly to your patient is just full of saline. So then you could take your flush off. This Y site here now is where you'll hook up your regular fluids. Sickle cell patients, especially in a pain crisis, should be on maintenance fluids. If they are not for some odd reason, then you at least need a carrier for your PCA because it's going to be running at such a slow rate. So you would want just like a small bag of 0.9. You can Y it in here and then just run it at like 5 or 10 so that it helps carry your Dilaudid in. Otherwise, just your regular maintenance fluids can hook in over here. So continue priming, we'll say no. Now it's saying my cassette's not locked. So my latch is up, but it's not locked. So we'll turn the key towards the lock position and then it'll ask you to start your pump. And we can say yes. So now it's running. Your either maintenance fluids or carrier will need their own Baxter pump. Those you can just spike and prime just with regular primary tubing. And then again, your tubing will hook up over here. At the end of every shift, so every 12 hours, 7 a.m. and 7 p.m., what needs to be done with the oncoming nurse is you need to verify your settings in the pump with them, dual sign them off in Epic in the PCA flow sheet on the narrator. And then you also have to check to see how many times that the button was pushed and clear that. So if your PCA is running, this is your button. Your green light will be flashing here if it's available for a bolus dose. To give that, your patient will push this blue button and then it'll start chugging it through for you. So now based on your pump settings, I believe in here, we put in 10 minutes. So for 10 more minutes, this light will not flash. So at the 10-minute mark, it'll start flashing again to let your patient know that they can give themselves another dose. If they push it when it's not ready, it'll give them an error message and say that it's not available. So if they keep pushing it, it'll keep doing the same thing. So you can click OK. So again, verify all of these with your second nurse. To clear the settings or to clear the doses administered, you'll go to reports over here. And then you'll click given NPCA dose counter. And then in here it says how many milligrams they've gotten, how many mLs they've gotten. And then down here it says they were given 1 push dose, but they attempted 6. So every time that they push this button, even though it might not give them a dose, it'll count that for you. So when you're doing shift change and going through this with the second nurse, you're going to click your given and attempted box and you're going to click clear doses. And now it says 0. And then you can go back and then you're at your home screen again.